Now for a few words to our audience and to briefly introduce the OMIC Technologies program. Let us all welcome the Executive Director of DOST-PCHRD and Lead Coordinator of the Philippine National Health Research System, or PNHRS, Dr. Jaime C. Montoya.
To our dear Secretary Fortunato T. de la Peña, our Undersecretary for Research and Development, Dr. Rowena Cristina Guevara, our panelists, Executive Director Dr. Eva Cuchonco de la Paz of the UP Manila National Institutes of Health, the head of the Institute for Neurosciences Memory Center at St. Luke's Medical Center, Global City, Dr. Jacqueline Dominguez, Dr. Ruth Pineda Cortel from the GDM Project Research Center for the Natural and Applied Sciences at the University of Santo Tomas, and Dr. Reynaldo Garcia from the National Institutes of Molecular Biology and Biotechnology of the University of the Philippines, Diliman. Our moderator, Dr. Sharia Lane de la Paz Silva from the Department of Medical Microbiology, College of Public Health of UP Manila, members of the media, and our fellow researchers who joined us virtually. Good morning and welcome to another session of Talakayan Heartbeat. Even before COVID-19, the Department of Science and Technology and the Philippine Council for Health Research and Development have supported projects on OMIC technologies for health. But the pandemic has finally thrust some of them into the spotlight, particularly the Philippine Genome Center, along with the University of the Philippines National Institutes of Health and the Department of Health. They are all currently responsible for identifying and classifying COVID-19 cases into strains. Because of their efforts and the data they collect, the government is able to make informed decisions on the restrictions and campaigns it implements. Apart from the sequencing and analysis of COVID-19 strains in the Philippines, the Philippine Genome Center also trains laboratory personnel from different health institutions for COVID-19 testing, specifically on the use of the DOST-PCHRD funded Gen Amplify RT-PCR kit, which is the first Filipino-made COVID-19 diagnostic kit. But the field of omics is not limited to genome sequencing alone. Beyond COVID-19, genomics, transcriptomics, proteomics, or metabolomics, the fields of study in biological sciences that deal with it, put it simply, the microscopic elements of our bodies, their processes and behaviors are also key in improving the delivery of health services to our fellow Filipinos. As research in this category consider the genetic makeup of our countrymen and formulating solutions in agriculture, health, and nutrition more suited to the Filipino people. Kumbaga sa damit, sakto ang labas. Today's discussion will shed light on other health concerns that OMIC studies can address. Issues like diabetes, colorectal cancer, and dementia. The studies we are featuring today, which were also funded by the DOST, Philippine Council for Health Research and Development, are focused on the early detection of these health concerns. I understand that to our uninitiated guests, the topics could be science-heavy. So if there are segments from the presentations you want clarified, please feel free to ask questions. We encourage everyone, including our colleagues from the research community, to join us in this conversation. The aim of our Talakayang Heartbeat sessions is to highlight our Filipino scientists and the work that they do to help improve the quality of life of their fellow men. So we hope that the conversation we spark here would not only help in improving their research, but also encourage you to share their work with your peers and the public, and perhaps invite them to our next session as well. I would also like to congratulate our project leaders for a job well done and for responding to the problems that need scientific solutions for the welfare of our people. Maraming salamat po at magandang agham sa inyong lahat.
Thank you, Dr. Montoya. We do hope that this will become a platform for our stakeholders to freely engage with our researchers and DOST officials. Today, we will focus on some of the research projects under the OMIC Technologies for Health Research Program. As mentioned by Dr. Montoya, our discussion will hopefully show us the importance of generating knowledge on Filipino genetics in the context of healthcare. Exploring genomics for health can help us provide health solutions and interventions that are more suited and potentially more effective for our countrymen.